Hi guys, welcome back to my channel, and if you're new here, hi, my name's Jess. I'm a mum of 3 and I post 2 new videos a week. I'd love for you to subscribe and stick around for more. Okay, so today's video is a teething video. Everything you need to know about teething, some tips to help you, to help baby, some facts as well. I am not a professional, but I am a mum of 3, so I've been through this 3 times. Yes, 3 times, and I can tell you it does get better. It is just a phase and they really are in pain, so try and be patient and try these tips out. I will recommend some products as well that have helped all 3 of my babies, and some new ones as well. Rashes, the red cheeks, they're biting your nipple when you're breastfeeding, screaming, cranky, all of the above, dribble, non-stop dribble, and shouting is a new thing that Hope is doing. First, 5 tips in order of effectiveness which has worked best for us. Teething toys and counter pressure to a raising tooth can actually help it come through, and biting actually helps them. So if you have teething toys, show them to them and encourage them to bite on that instead of their fingers, and then that can help them. 2 is distraction. Yep. Distraction. Whatever you can do to distract them from the pain. Think of new ideas and things like that. I mean, sensory play is great. Sometimes I'll just hold Hope and take a wooden spoon and go around the whole house, and I will just whack everything that I see, every spatula that's hanging up, show her the different noises, and it gets her brain working and it distracts her from the pain. So yeah, distraction is a massive one. And cuddle therapy also is in with number 2, because it is an actual thing, I know, and I think babies know that because they don't want to be put down. But yeah, as much as you can cuddle them and baby wear, and I know it's exhausting, but you really have to understand that they are in so much pain. Rubbing the gums, you can rub the gums and massage them with a clean finger. I made these yogurt lollies or breast milk lollies if you're breastfeeding, and they are amazing. A washcloth, a damp washcloth, or a microfiber cloth if it's clean. So the comfort blankets, I'll just add a little bit of water to and put them in the freezer. For food to chew on, cold carrots and cucumber, I normally will chop them up ready at the start of the day. If you're putting them in the fridge to keep them cold, you want to put them in water or else they start to go a bit funny. Medicine, obviously, last resort. We just need that bit of help, you know, baby really needs pain relief, and if it's night time as well, babies feel pain more intensely in the night because they've got less distractions. So our top pain relief obviously is paracetamol. It doesn't have to be Calpol, but it should be age appropriate. Ashton and Parsons powders, and I've been using these on all 3 children. She can actually have, I think these were from 3 to 6 months and 6 months and over, so yeah, if they're teething early, I'll put a clip in of when she was little and she was having them, and she even recognised when you bring in the packet to her that it helps. Like, she knows now she's happy and it helps and it soothes. And I think the little granules, when you rub them on their gums, they actually really help. Oh, wow. More. That better? Yeah. More. That it? Yeah. That better? Yeah. Yep. So they're about $3.99 in B&M, and you can get them in chemists as well, or Amazon if you want. So we've got lots of them in there. And also, if baby has a teething rash, Hope hasn't. She is dribbling a lot, but I tend to just be there to wipe it because we're here. But their boys did used to get quite a bad teething rash. and it's harder to treat than it is to prevent. I would recommend a barrier cream, either Vaseline or I tend to use this one because I'm not sure whether you can see it. It's Lancino and it is for sore nipples and cracked skin, but it's an amazing lip balm and a brilliant barrier cream, and obviously it's safe for babies to ingest. So yeah, so I'm not too fussed about putting that around and on her skin. Have everything upstairs next to your bed. So I have our Calpol, well, just paracetamol, and a clean syringe ready, a bib, because you know when you're giving them Calpol, that a lot of the time she will just spit it out and it goes everywhere, and then they're sticky, and if it's in the middle of the night you don't want to be changing them, like a whole change in the middle of the night. So definitely make the, you know, just put the bib under and wipe them out because it's sticky and not nice. So I have a clean bib in there ready as well. Like, this is my night time. But once the tooth has come through, what do you do now? So you need to get a tiny little baby toothbrush. In fact, it doesn't have to be tiny, it just has to be soft bristles, and you need a small grain size of toothpaste just to keep the tooth clean. You could even just use a cloth if you wanted to, a clean cloth, until the tooth is actually, you know, fully out of the gum. Do it last thing at night as well, after they've had their usual meal or their milk. I know that can seem quite strange because we feed them to get them to sleep. Well, I do, and apparently that's really bad for their teeth, but you know what, you are the mom or dad and you do what's best for your baby, but that is what's recommended. We actually booked Hope into the dentist. She was 6 months and still teething, because the boys had a checkup and we had a checkup, so we just took her to get her in the, you know, she sat on my lap and had a little look and just felt her gum, and yeah, just gets her used to it, and she's registered. So now that her first tooth has come through, yay, we can take her back to the dentist and he can just check it over and make sure that everything's okay, but I'm sure that it is. So they have 20 teeth, 10 on the bottom and 10 on the top. The front two at the bottom usually come through first. I'll put a little chart up to show you what comes in when, but every baby is different, every child is different, every adult is different. I say I've got 3 and they all came in at different times. I think Rio's first tooth came when he was 7 months old, Riley was 8 months, and Hope has only just got hers and she's nearly 11 months. So don't worry if they don't have their teeth. It can take up to 1 year, and the teething process actually lasts up until they are 2 or 3 years old, but everyone is different and they're not going to be an adult with, you know, like a gummy bear adult. So don't worry, just be patient and not being naughty. They are just in pain, they just want you to cuddle their mom, dad, and you just really have to be so patient. Forget routine, just go with the flow. They probably won't want to eat a lot as well. They might do, they might not. Just keep up their fluids, make sure they're having the milk and water. Right, so I would recommend a few toys. Ethan the Fox is amazing. That is a new one that we picked up this year and we've had him a while now and she absolutely loves him. It really helps her, like she just likes to just bite on it and it makes a noise too to distract her. So that would be number 1. Number 2 would be the teething powders, because I've just used them with all 3 of them and they really seem to help. They seem to help calm them down as well and distract them. But yeah, lots of the bandana bibs, and they're brilliant because the dribble can actually pull down into the neck sometimes and get quite sore. So yeah, lots and lots of bibs. You don't want them getting damp. I will try and put a picture in now of the symptoms of teething as well, and what to look out for if you're not sure if your baby is teething, but pretty sure if you're here they are. Yep, sucking can help for pain relief with babies too, so let them drink, let them, you know, not something sugary. Obviously if they're breastfeeding, that is a comfort to babies as well. I'm breastfeeding at the minute and seem to be, I feel like she's just feeding constantly all night just to comfort herself, and yeah, it's exhausting, but anything to get some sleep and to comfort her and just, you know, just get through the night. We just got to survive, don't we? And it really doesn't last forever. Everything in this tiny little first few years is a stage, and you'll miss it when they're older. Like my big boys are in their rooms now playing Xbox. They don't really, you know, because she's having a really long nap, and just leave the mess, it will still be there. Just cuddle your baby and comfort them. Take them outside. I'll try and do another video on how to entertain a baby, because I have so many ideas, especially us being on lockdown at the minute. Yeah, lots of sensory, lots of play. Get all the cushions off the sofa and make your own like soft play. You don't even have to dress up, and you don't have to pay through the nose for a coffee like we do here. Okay, so that's it for this video. I hope that you found these teething tips helpful and that it helps you get through the night, the days and everything else. If you have any tips, just let me know in the comments, please. Any help you can give, because we're all still learning. We just need to help each other out, and I really hope that this video helped you. So if it did, please give it a big thumbs up, and don't forget to subscribe so you can follow us. We have a weaning video coming up too, so stay tuned for that, and I will see you in my next video. So bye guys.